Because people don't think about like sitting in your car every day where the sun's beating down in on you constantly, or things like that, just walking. That's actually where we see a lot of people get sunburn. Guys that are a little bit possibly balding on the top, they have to be careful. We see a lot of cancer and precancer spots from sun damage there, a lot of precancer on the ears and the face and the arms from where the sun is beating in through car windows. I even had a patient earlier that was saying like, oh, I wear sunblock when I'm at the pool or when I'm at the beach. But realistically, you don't think about that everyday sun exposure that really does lead to the long-term damage, sometimes just as much, if not more, than those severe burns. Skin health is actually really important. I think what people don't realize is skin is actually the largest organ in the body, and it's responsible for a lot of things. It helps to protect your body from like pathogens and from getting damaged. It helps with temperature control and sensation and touch. But it also helps to maintain moisture and prevent dehydration. So it really is important that we take really good care of it, because it's kind of like our outward armor to protect the rest of our body. I mean, with it being summer and with it being as hot as it has been, you know, definitely sun is one of the biggest things that come to mind. And with that, you have to be careful. You definitely have to wear SPF when you're outside. We recommend at least 30 plus. You don't really have to get anything higher than that, but you don't want to really get anything lower than that either. So that's really important to kind of maintain your skin and prevent sun damage, because that can lead to things like skin cancer and also increase things like aging and decrease the moisture in your skin. So it's certainly important to protect yourself from sun. But there's other things that people don't think about as well. Like, I mean, rashes, things like eczema can kind of pop up in the summer. So it's really important to kind of make sure that you're moisturizing your skin on a regular basis. Simple things like when you get out of the pool or when you get out of the shower, instead of rubbing your arms, you want to kind of pat them dry more. Also making sure that you're moisturizing at least once a day, especially after showering. All that can be really helpful. And we honestly recommend to our patients using products that are free and clear of any sort of fragrances or additive ingredients. And the good thing is now they make those in a lot of like easy to get products like Tide and Gain and things like that. So it really is simple. But all those can kind of help with your daily skin health. Skin health is important all year round, and I think that's important to realize. Even simple things like sunblock in the winter for your face especially, people forget about that. But we recommend just a daily moisturizer with SPF for your face on a regular basis. And simple things like moisturizing daily, especially after a shower, and trying those free and clear products. That's an all the time thing, yeah. Yeah, your skin definitely changes as you age. As you get older, your skin tends to get a little bit thinner. It loses the elasticity. It loses some of the moisture. And so you remember, it's kind of like the barrier and the protector of our body. And so as you get older, you have to use extra caution. You have to make sure you're definitely using sunscreen. You definitely have to use those moisturizers. And simple things like Tide detergent that some people may have used their entire life, as your skin changes, they might become more irritating for you. So you really might have to consider switching to more sensitive products. The other thing we find is a lot of people use things like Ivory or Dial soap, which are great soaps, but as your skin changes, sometimes those become too harsh, and switching to more sensitive soaps like Dove or something like that can be helpful as well. Acne is another thing I think it's important to point out, especially with summer, with the sweat and increased activity and sunblock and all those extra things that we're putting on, that can increase acne. With that, one of the best things that you can do on a regular basis to kind of help curtail that or prevent that is just wash your face once daily with a good face wash, something that's hypoallergenic and mild, not a lot of fragrances, and then follow that up by a good moisturizer. That can really help kind of prevent acne. And then also simple things like after you have been at the gym or you have been outside, just kind of washing your face. Those can all be helpful as well. And you want to look for products that say they're dermatologist recommended and non-acne forming or non-comedogenic. Those are important things to look for as well. Eczema can be a little bit more tricky. Not everybody has that, but certainly a lot of people do. It really is just a kind of a chronic dry skin condition, and some of those other things that we talked about can certainly help to prevent that, or at least manage it for those that have it. You know, there are some people that have certain things like gluten sensitivities and things like that, but for the most part, no, I think that's, I mean, there's a lot of that is a misconception. For some people, certainly there are some dietary issues or allergies that are involved, but for a lot of people, one of the best things that you can do is just kind of wash and moisturize your face on a daily basis. A lot of times making major changes to your diet with things like sugar or gluten don't really make a big difference. It definitely does. I mean, you think about in this area, we have a lot of woods, we have a lot of hiking, kayaking, people are really active and they tend to get out a lot more. With that, you have to keep in mind we're certainly in the area where you see a lot of poison ivy, poison sumac, poison oak. So you definitely have to be careful with those. The other thing that's huge in this area right now, unfortunately, is ticks, and they're deer ticks. So I mean, they are associated with things like Lyme's disease and a lot of other tick-borne illnesses. So with both of those, the poison ivy and poison sumac and poison oak and the ticks, one of the best things that you can do is when you're out in the woods or out hiking, honestly, I know it's hot, but if you wear kind of longer, thinner pants that are kind of made for that, as well as longer shirts, that can certainly help prevent it. And also just some bug spray. And the other thing too is you want to make sure that you're really showering and washing your clothes good after you are out on a hike, because that chemical that's on the oil really can carry pretty easily. So you want to make sure that you get rid of that as fast as possible. Yeah, first we go back to the, the sunscreen and kind of being careful in the sun, wearing hats, wearing sunglasses, making sure you're putting the SPF on your face and your body on a regular basis. The best way to kind of deal with skin cancer is to prevent it in the beginning. But the other thing, kind of once you get past that, a lot of the things that we see are kind of things that creeped up from old sun damage. When we're younger, we don't think about that stuff as much, but as we age, we start to kind of see the damage that the sun has done in our skin over the years. So what you want to start to look for are any kind of spots that seem like they're not getting better. If you have like a scabby area that seems like it's been there for a while, or you thought it maybe was a pimple, but it's not going away, and it kind of flakes off and bleeds sometimes, but then comes back and it never really heals, that's actually a sign of a precancerous spot or possibly even an early skin cancer. So if you have any things like that, you definitely want to get them checked out by your family doctor or definitely by your dermatologist. The other thing is to look at your moles and spots, anything that seems to be changing color or changing shape or increasing in size, or if it changes and starts to become itchy or bleed or anything like that. Those are definitely things that you want to point out to your provider as well, because those could be signs of something like melanoma. I mean, there are varying degrees of sunburn for sure. I mean, you kind of have just the mild sunburn. Sometimes it doesn't even peel. I mean, one of the best things you can do for that is use aloe or, moisturizing lotion. But sunburn can actually get very severe, and you can get like 2nd and 3rd degree burns that sometimes you have to treat them a little bit more. So if you ever have a sunburn that's really blistering, or you develop other symptoms like fever or signs of infection or anything like that, that's certainly something that you might want to talk to your doctor about or be seen for, because that could be a sign of something more serious like sun poisoning. And also it depends on like how fair your skin is. Certainly people that have more fair skin, we usually say light hair, light eyes, fair skin. You have to definitely be more careful and more cautious than somebody that maybe would have a darker skin and darker eyes, because they're not quite as sensitive. So those are definitely things to look for as well. And honestly, a couple of bad sunburns can really cause major issues down the road. So the best you can prevent those severe sunburns in the beginning, the better off you'll be in the long term.